Hi, everyone. Welcome to Perspectives. I'm Martina, and we have my lovely co-host, Lisette. And as you all know, we have started to do a healthcare racism in America series that we have kicked off. And we have a lovely guest here, Dr. Jairo Mejia, who is a physician that we have the pleasure of knowing. Through our past work, and he generously decided to come on and talk a little bit about himself and about his career, which has been pretty, I think, dynamic. He's originally a physician from Colombia who has since transferred here to the States. And so we'll turn it over to him and just a little bit to kind of go into his backstory. But Lisette, feel free, jump in, anything you want to add as well.
Yeah, no, thank you everyone for kind of tuning in to this episode and in this series about healthcare in America and sort of the state of it. I'm excited to just kind of hear from Dr. Mejia and his sort of his perspective of healthcare and coming from Colombia and then here in the United States and then getting into a conversation of what you have seen in sort of your journey, even just thinking about the difference between healthcare and in your home country versus healthcare here in the United States and what that looks like. But yeah, I think this is going to be a great conversation. As you all who have been listening to us know, we try to keep it as a conversation and kind of learning from it. But this first part with Dr. Mejia will really kind of look at what your journey, Dr. Mejia, and your sort of where you're at, and then we're kind of dig into the deeper kind of connotations of this topic of healthcare and the impact of biases and racism, particularly in the United States. So Dr. Mejia, I think we'll turn it over to you just to kind of introduce yourself. Tell us a little bit about your journey as a physician coming, in Colombia. Like, what was the education there? Like, how was healthcare there? And then was there a culture shock when you came to the United States? What did that look like when you were here? So I'm just, just gonna give you the platform and we can start our conversation.
Thank you so much. First of all, thank you for inviting me over. I'm so excited. It's one of these things that, you have a story to tell, right? And sometimes you don't feel like having a scenario to share the story, right?
Mm.
My story is the story of thousands of, physicians and any other professions. And I'm going to speak about physicians from all over the world, right? Who came here for different reasons, right? Different reasons that we can elaborate later on. But yeah, when I go back and see myself in 2002, I ask myself, what was my thinking process? I don't know if I was in my whole sanity. my story is absolutely, where it can be called crazy, right? Crazy, but happy to share with you and with everybody who's listening to this podcast. So from Colombia, in Colombia, I mean, there are so many areas. Maybe you remember Bogota, maybe. I'm from the south of Colombia. So probably you have heard about Cali, Colombia.
Yeah.
That's a city in the south. Well, I lived in Cali, but originally I'm from the south of Cali. It's a city called Pasto, Colombia. So I lived over there for 15 years, moved to Cali, and then went in the middle of the two cities is Popayán. So this is an area where I went to med school, met my sweetheart, got married, did my internal medicine residency over there, and quickly became, very embedded in the medical field, working in different scenarios. I've done everything, right? I've done intensive care unit, I've done inpatient, outpatient, private practice, administration, like all kind of things,
Wow.
So that was my life. So I was a happy provider in Colombia, seeing my patients, really, really happy. Then 2 boys came to the family, right? That changed the perspective.
Okay.
We're talking about the 90s, right? The 90s.
Yeah.
So 1998, things started to, complicate a little bit in Colombia. Then we took 2 sons, and let me put this really straight. We have a very established, life with, good jobs, our practices. My wife is also a physician, she's a pathologist, I'm an internist. We were doing well, we were happy. We were have a university tenure, we were fine. However, there was one piece of the puzzle that we were missing: safety for our families.
Mm.
So that was and I remember the whole process of making the decision, what are we gonna do, right?
Yeah.
And looking for opportunity safety, not even knowing how was gonna be life here. Just to start, right? I didn't speak English at all. So for me, it was starting from scratch. I could read English, right? But listening, nothing. And I was unable to hold a conversation. So 20 years later, right? It's going to be 20 years this June. Now I realize that I've lived more in the United States professionally than in Colombia. I've been practicing for 16 years in Colombia here, plus 3 of residency is 19. I practice in Colombia only 10 years.
Wow.
Isn't that amazing? Yeah. So it's more life in this side than there. So this is more or less. So I came here. I had to do my residency again. It's the law. You have to train again. I trained in a hospital in Chicago, Mount Sinai Hospital. Hospital with a lot of challenges, and that really I consider my residency a turning point, huge blessing in my career. Because I landed to the the health system that really represented my interest, right? Before I came here, I started working in community health in Colombia, in underserved populations, because I found them more rewarding. So training over there was the segue to work then in the company that I work now, in the admin side, and also seeing patients. I still see patients once a week. So that's like in 2 minutes, bio. That's my bio in 2 minutes. So tell me, when you immigrate at age of 40, you're kind of crazy, right? I was 40 when
you did it, though. You did it.
I was 40. I was barely speaking English. My co-residents could perfectly be my sons. So it was an amazing adventure. Amazing adventure, right? But I don't regret one single second, right?
I think Dr. Mejia, you've kind of shared a lot of what I think the immigrant story is for people, and migrant story is of like, there was something that was happening in their home country, right, that forced them to move, and for a lot of time it is that safety thing. So when you share that, I think that resonates across, I think, any sort of profession or anything, because I think we all, people understand that, especially those, like for me, who I'm a first generation here, and hearing my parents' story, and they've lived here now longer than they've lived in Mexico, and they're like, I can't go back living there, and in doing that, and seeing that. So I think hearing your story just kind of resonated like so much with me, because it's like, it's the story that I hear a lot from people who make a decision, who are like, I don't even know how I did it. I came here, got a job, but here I am 20, 30, 40 years later. And my kids have grown up here and all these things. So just kind of hearing your story is sort of just amazing. I mean, I don't think it's crazy. I think it's such a story that resonates.
I'm passionate about the story. I'm passionate about histories of immigrants, right? From movies, right? I love really reading or watching movies about immigration of all kinds, right? If you try to define an immigrant, right? First of all, it's an adventurer, right? It's it's a person who was able to give up everything. We technically left in the past in one day 10 years of work, experience, position, everything. We left everything over there, right? But it's when the motivation is really high, right? I know many people. We have a lot of colleagues that immigrate because of different needs and opportunities, right? In some countries, finding even a job for a physician is not easy. That was not our case. We were very well over there, and we decided that this, and this is what I consider is this I don't know how to call it. I don't know if it's braveness or irresponsibility. I don't know. Leaving everything behind, taking your family and coming to here with couple, bags and start from scratch from zero, and going to get your driver license and your social security number is like starting your life from scratch again. And I was 40. So, but anyway, it's a great, great journey that I'm proud of that, right? And my family, we are so grateful because we found really a nation that embraced us, right? Kids, obviously, they were 8 and 10. They quickly, right, embrace the language and the culture. But confronting this, not confronting, but reconciliating these values, right, from being Latinx and immigrant and embracing this culture. And I still remember a conversation with my wife in the American Airlines flight. And I said, okay, we're going to start a new life here. And we made a decision that during the flight, number one, that we were going to embrace the culture, right? We're going to learn holidays. What exactly is Thanksgiving? We don't have that, right?
Yeah.
The from food to culture to language, right? The law, there are so many things that are different, right? So that was our decision. I remember clearly that conversation with my wife, and it was a great experience, quite frankly. Yeah, it was tough. It was really hard, but we made it. Yeah, we made it. So I'm here happy, discussing and sharing that with you. That makes me feel really happy.
Dr. Mejia, just so when you first got here with your family and probably just a few bags, how long did it take you, as you said, you really wanted to immerse yourself in the culture here? How long did it take you to really get your bearings?
Yeah, I can tell you, I'm adaptable by definition. All my life, I can adapt quickly. However, it was really difficult, especially the language. When you're young, you can learn the language so easy. Actually, experts say that you don't learn, you incorporate the other language in your communication skills. But when you're 40, it's a different situation. And I remember being a resident at Mount Sinai and having, my first rotation was intensive care unit. So go figure, me trying to understand the family members and everyone, asking for support from my friends and the interpretation services in a really busy and stressful environment. It was not easy, especially the first 3 months. Those first 3 months were so difficult. The 6 months landmark, and now I, kind of got it, right?
Okay.
And then it's history, right? And then I got it. So I was able to, and every day I continue learning, right? I continue learning every day because you will never be as proficient in the second language as you are in your native language. Absolutely, because after 20 years, right, I still know how many errors I do when I speak, when I write, right? Even a simple email, right? Because it's not your language, right? That's a reality. You can live here forever. And, initially I was so embarrassed about my accent. And then it was a process of assimilating this. And now I take ownership, pride of my accent, right? I'm so proud of my accent. I love it, right? I'm not fighting my accent. I like it, right? As long as Martina and Liz can understand what I'm saying, that's good. That's good. My accent means that I speak 2 languages, which is good.
Yes.
Yes.
That's exactly what that is. I think you bring up such a good point, because I think a lot of people feel embarrassed or shame of having an accent. I remember recently, a few months ago, I was part of a panel and someone was asking a question and they apologized because they had a heavy accent when they were speaking English. And someone told them, like, don't apologize. You are working hard to learn a second language that a lot of people would never try. Especially in this country, a lot of people would never try to learn a second language and do that. And I was like, and you just reminded me of that, because it's so powerful to say that you embrace it, you take pride in it, because in a country where sometimes that's frowned upon and that's seen as something not to be proud of, I think it's so great to hear you say that, and for others to be able to, like, say, like, yeah, this means that I've I've done something. I've worked hard on learning a second language. Someone who navigates two languages and finds it hard to talk either one of them sometimes. Like, I'm like, especially when
So
you
this
put
is
me in a stressful situation in Spanish.
Funny.
so let me tell you what is funny, and a personal anecdote. So a couple of years ago, just at the beginning of the pandemic, I read something that when you learn a second language, it's easier to get to learn a third one.
Oh,
So yeah, I didn't know that concept, right? So anyway, I we did have a discussion. So okay, I mean the pandemic, right? You're not commuting too much. You have a little bit more, time to do different things. So we decided to give it a try, and we are learning Italian. And
get out of here. Oh my goodness.
but only for fun. I don't even have friends to talk in Italian, but it's just for fun because we like it. And it's kind of some similarities with Spanish. So now we've been doing Italian, and yeah, it's easier, of course. And it's exciting. It's exciting, right? It's
But you got to tell it. You got to mention your
Oh my God.
Italian. You got to.
Dr. Mejia, you mentioned Italian. I actually accidentally minored in Italian when I was
you.
when I
Wow.
was in college.
Molto bene, molto bene.
And I did it because I said I was gonna do a year of a foreign language in college, and then I just stuck the 3 years that it took to get the minor. But so when you said it, I was like, oh, maybe one time maybe we can practice, because I know I've forgotten it, but it was easier. It was easier when I was immersed in it and talking. It was just so easy to just have a conversation with my professors. There's a lot of similarities with Spanish, which sometimes I would mess it up, and my professor would be nice enough to be like, okay, you're kind of talking in Spanish, Italian there. It's not
Hey,
gonna work.
let's challenge ourselves. Let's do a podcast in Italian in 10 years. I don't know. I don't know it's gonna
I'll
happen
let y'all
before
two do it. I'll let y'all two talk, and I'll just.
Martina, you got 10 years. You got 10
I
years.
don't know. Y'all over here. It's just so interesting to hear about both of you being, to me, I believe, is very well spoken in both of your languages, whether it's your home language or the language that you've learned here, and then like learning a third language. Here I'm like, we have people in the United States that we can't get English. Like they just can't they can't get English right. And I just think, because I will say I spent my time in college. I did French. That's what I gravitated towards. And it's just like, well, I remember Lisette and I talking about it, about the Italian. And I think you had to tell me again, because I was like, Lisette, didn't you take Italian? And then we started talking, and you were like, there are so many similarities between the Italian language and the Spanish language. So it's just a coincidence that both of you speak a little bit Italian. I guess so. I have 10 years. I'll see what I can do.
I think we took a shortcut because French is so difficult, right?
It is
Forget about German. So I think we took a shortcut, Liz, but it's good.
Yeah.
It's good.
It's good. I did French in high school, and I did not do well with French.
Oh, no.
Not in high school. It was not the language for me.
Yes, it was. Yes, it's not an English language, but none of it is. But yeah, it definitely is. And I was immersed in it because I wanted to make French my minor as well, but I had taken all of FAR as the language series was, but I had to take more like French literature and French culture, and it just wasn't working out with my schedule. But I did really want to minor in it. But literally, by the time I think it was French 4 or French 5, the entire class, you're just speaking French. And it really did help because everybody was speaking the language. And even if you messed up, it was no criticism, because it's just everybody's there to learn, which I thought was a really beautiful thing. And just this conversation around exchanging languages is just great. I love it.
So good. But Dr. Mejia, you're talking about sort of your sort of starting off, your residency here in the United States, and then kind of doing that. Like, can you give us a glimpse of what, the difference was as you were learning, the healthcare system in the United States to what you knew and how you practiced in Colombia? Like, are there differences? Like, are there big differences? Are there similarities, or just this different way of treating patients? Like, do you approach even treatment differently? Like, how was that as sort of the transition from what you are used to practicing in Colombia versus how you had to either adapt or accommodate or adopt here in the United States?
I mean, let me just start by saying, in both environments, you can find everything, right? From the highest healthcare with all the technology and the science behind it, through the no care at all, right? So you can find both in the two environments, in an undeveloped country and in the United States. But I really want to share with you what I call my professional aha moment, right? So this happened about probably September, October of 2002. So when you start the residency, you start doing your rotations, your inpatient, right? So I started ICU, then I did some floors. By the third month or second or third month, we started doing what is called the clinics, which is the outpatient experience. So you will be sent to a health center, a clinic, and you will be paired with a preceptor, right? Who's going to be your attending. And usually you do 1 or 2 clinics per week. Now, in my case, I did, because I was in a special called primary care track, I did 2 clinics per week. It was 2 afternoons where I go from 1 to 6 to see patients. So this is what happened. So I went to see my patients for the first time. I knew the clinic that I was going was heavy on Spanish speaking people. And the reason, because obviously they know that I speak Spanish, so they assigned me to this clinic with a lot of Latino population. So I remember going there, met my preceptor. So he said, I know you have experience. I said, yeah, I've been working for 10 years as an internist. So he said, well, go ahead and see patients. I mean, yeah, because this is nothing really. I mean, for me, it was natural, not completely natural, because this is what I've been doing for 10 years, right? Seeing patients. So anyway, I went and started seeing patients, and that's the moment when I found the sad reality that I never imagined, That's when I saw the inequity, the poverty, the lack of care. So we're talking about 2002. No Affordable Care Act, no Medicaid expansion. Every adult that I saw in that clinic had no insurance. So here I am, seeing a group of people with, so many challenges, right? Like every other patient was and is a diabetic. It's a community in Chicago, extremely affected by, diabetes and social situations. So I remember when I finished that day after seeing, I don't know how many patients, I was so moved and touched. And I think, I can't even believe that I emigrated to the United States of America to see this situation. I couldn't imagine. And, we're not talking about rural America.
Right.
That health center is literally a 10 minutes drive to downtown, to the Gold Coast. I was in disbelief. I was completely in disbelief. That was like, practicing in a very depressed area of Mexico, I imagine. I suppose it's or in Colombia or in Venezuela, I don't know. That area is particularly challenged, right? So I remember before I left the clinic that day, telling them my preceptor, I said, I want to work here. This is what I want to do when I finish my residency. He laughed and he said, yeah, we'll see. He said, yeah, I want to work here. So, I was completely decided to work over there, right? Yeah. So it's interesting because as I built my connections with the patients, I really felt passionate and I fell in love with this practice. So by the time I finished, I already have a full practice built. And it was very interesting because I finished my residency in 2005, it's 3 years. And I remember it was like a Thursday. By Monday, I was already working over there, right? Which is not typical today. You never start working as a physician in 1 day or 2. It takes 3 months at least, right? For credit. Those were different times.
Yeah.
I didn't take any time off. I just started work immediately. You know, I have a family to sustain. So, but anyway, that was my aha moment. That afternoon in that health center in Chicago, inner city, where I found, that, what is picture about the United States outside is so far away of the reality, so far away. And then I was grateful because of my age, I guess, right? I only had the opportunity to do 3 interviews for residency.
Mhm.
Only 3. One was in Ohio. It was in Cincinnati, and it was a community mainly from Russian immigrants. And then I did 2 interviews in Chicago. I did the one in Mount Sinai. The other one was with a private hospital. Again, decision points, turning points, right? All of them offered me the same. And I decided to take this one. Oh my goodness, I never regret it. What if I choose the other one? I will be completely boring practicing in a private practice. So I'm so happy to have chosen this pathway for my career.
I'm always so inspired to hear the stories of people who are in the health profession, such as physicians and nurses, in their stories, like you just said, like, you could have went to 2 other different hospitals, but you chose to stay at Sinai. And so, I know you still work kind of in the same area. And so, Dr. Mejia, since when you started to where you are now, would you say you have seen some improvements, or is it about the same? What are your thoughts about that?
Huge improvement, huge improvement. A game changer was the American, the Affordable Care Act. The Affordable Care Act changed everything, right? It was a huge step to fight health inequity.
Mm-hmm.
I remember one day my preceptor called me. I just recently started working in the company, and he called me and said, I just want to be clear with you, Jairo. We are not really important in this organization. I said, why? He said, because you and I are internists. Family doctors are important. We are not. And the reason is because, the only group that has access to Medicaid, the only group is really the pediatric population. At that time, it was only pediatrics. You become 18 out of Medicaid. So this population had no coverage at all, right? Not to mention that between 20 to 30% were people not even eligible for Medicaid, regardless, because they were undocumented. So the Affordable Care Act, when you can really acquire insurance, and being, kind of a sponsor, and, and the Medicaid expansion that Illinois went for, we saw a huge, immense change, right? Because that gave access to millions. And I can tell you, I remember that time, after the implementation, we started seeing a lot of patients, and this is difficult to believe, right? People in the 40s, 50s, whom, last visit with a doctor was the last pediatric checkup. Never a checkup, never a physical, never a screening test, nothing, never nothing. The last medical visit was the last pediatric visit.
Wow.
Years or decades ago. That was so common. No insurance, no care, no prevention, nothing. So the other big portion was medications, right? So initially, there was no access. Getting medications was so expensive, right? Then we have, God bless their heart, they have the $4 programs for many companies. They brought the $4 program for medications. That was a change, immense change, because there were a huge amount of medications that you can purchase for $4 a month. And then after that, it came the 340B program that at that time was really, really still beginning, right? And today plays an important role for communities around the country with no access to insurance. 340B program is a huge program, huge support for patients for medications. Technically, I dare to say that if you don't have access to medications these days, it's because you don't know exactly where to go. Because you can access to technically any medication at an extremely affordable price. So so big changes, but the inequity continues, right? The inequity continues. There are many other things, like, for example, the quality of care that our people get. When we talk about our people, like, let me be flat on this. I'm a minority, right? And I'm very proud to be a minority in this country. So we minorities get lower quality of care. If I have a heart attack and I go to the hospital, my treatment, studies show, could be under, quality standards that, for minorities. That's really sad to say, but it's the reality. If I have cancer, chances are that I'm not offered everything that is available. That's a reality, and studies show that, right? So we had still a lot of inequities, a lot happening.
Oh my gosh. I hearing you talk like through me here right now about like just one of the things that stood out to me was when you talk about when the Affordable Care Act came into place and people had access, and you start seeing people in their 40s and 50s who had gone so long without medical care or just regular checkups, like your yearly checkup that you're encouraged to get, and they hadn't done that, like, and the Affordable Care Act was just not that long ago. Like it's not something that is been in place for a long time, and to hear that happened, and to know that for so long people have suffered, have gone without care, and just because there isn't this idea that healthcare is a right, in this country, like there's that thought process, and that just struck me because I'm like, I can't imagine being in pain or knowing that something's wrong, and you just kind of either stick with it and try like a home remedy or something, and you just and not go because you can't afford it. I mean, it is expensive. It's expensive to get care, like no insurance. I don't wish it on anybody because that will drown you in debt, and you
Absolutely. Putting your feet in the ER as a patient, starts with $10,000, $5,000 to $10,000 minimum. And just putting your feet in the registration, you're there. It's like that. But there are components that we need to remember. I mean, and it's important to remember this, right? Pre-existences, right? I remember many patients were denied, and they came to me and said, I asked, the same questions, do you have any insurance? Were you able to get insurance? He or she said, no, because I'm diabetic. So I'm not an expert in economics, right? But if you deny insurance to a patient with diabetes, right? You deny insurance for people to get mammograms or tests for colorectal cancer, right?
Yeah.
That's gonna be more expensive, at the end. I mean, like 3 times more expensive, right? If I have a patient who has, a small polyp that is detected in a colonoscopy or a fecal test, and I take out this polyp, imagine, right, the cost of treating the colon cancer, right? Diagnosis, chemo, surgery, radiation, the cost of the life of the person, and the quality of the suffering and pain. And if we are going to purely economics, productivity. So, I mean, it's like a very simple math for me. Preventive medicine is the best investment, right? And there were more. Remember, before the Affordable Care Act, you have children, they were uninsured after they were 18. And now they have coverage until 26. 26, they have more chances to be in the market of working, right? And getting insurance. But before, you have a huge gap of these young people who also get sick, right? And no insurance, no coverage. That was tough. That was really, really tough. So again, it's a little bit of here and there improvements that are humanizing the situation a little bit like before. But you know what is interesting? I still listen to conversations from congressmen, groups, activists, the health industry, advocating to eliminate pre-existences. How can you in your sanity can even advocate? For me, it's just a slap in the face for people, right? It's unbelievable to think that those discussions are still happening.
Yeah, when you brought that up and you bring in sort of the point of view of hearing, people who we vote in, obviously to government, and they're talking about taking away something that just helps people, and you brought up such a good point, Dr. Mejia, of like this prevention, this idea that prevention is key, and knowing and having access to that, and sort of like, so you don't get to a point where someone is in need of drastic measures or having to go through these treatments, when a lot of the diseases that we see are preventable if caught early, if done, if you get your regular, like I said, that those yearly checkups and those yearly things that are supposed to happen, and and to see that, and even to hear the idea of like pre-existing conditions at the time that we're living in, right? We know that COVID is going to lead to a lot of people having some sort of pre-existing condition that they didn't have before, because and all these things, and you hear it, and you kind of have these conversations of inequities in healthcare, and what do people do, like, and you, like me, I think about, like, I think more of like my parents who are older, and depend on like a Medicare, and and then it's sort of like, even that is limited, like that's, you're paying for it, and
So many limitations around
it's
Medicare and
so
Medicaid.
hard to get care. Like, I'll share a little bit. My dad recently, he fell, and we had go through this whole rehab. He's still rehabbing, but just to go through the system to get him the care that he needed, because he was underinsured, I was like, how is this America? Like, how is this the great country that is supposed to be like the best in the world? And I'm over here struggling to get my dad just basic care, and just for someone to humanize him, to humanize the healthcare system. It was so difficult to kind of see that, because they see it as a business and not as a person,
Yes.
not as humans.
Right. Not to mention, I think this is number one reason for bankruptcy, or one of the top 5 for bankruptcy. You can lose your home. You can lose your home if you have a serious condition and no insurance coverage. But if you want to take me to COVID, grab a coffee, because we can be here for 5 hours. I mean, you wanna go there? Really wanna go there? Oh my goodness! That was moving the curtain and getting us exposed to the most miserable, unacceptable social injustice. I mean, it's like, really, what, and not only here, worldwide, COVID really took out the mask. We were living in a technically in a lie, really. When you see what's happening with COVID, it's really sad, and we need to really learn from this, and I hope we will learn something, from this pandemic.
I'm still surprised, Dr. Mejia, like you said about COVID, I can probably talk for hours about that too, because it just, to think that this is something that had to happen for people to really get a better understanding of all the inequities that exist in healthcare, and still people really don't get the picture. Because similar to what Lisette is saying, I've had a similar experience with my father, he's on Medicare and on Medicaid, and he just tried to go to a doctor's appointment the other day, and because he didn't even have his card, he couldn't even take his appointment, which he needed. So he had to end up rescheduling because he had to get his card in the mail. But to me, it's just saying that these inequities that have been here, it's just COVID just continues to exacerbate the issues, especially in the communities that we serve. And I'm just wondering your thoughts, probably not the 5-hour version, but your thoughts around, where do you kind of see COVID taking the communities that we serve? Or how it's, I mean, even though it is impacting, but how do you see this kind of playing out in a way as we continue in this pandemic? Because it seems like every other week there's a new variant, and there's still people who are not vaccinated who just won't get vaccinated. And some of those people are within the communities that we serve again.
Martina, you can take picture of this situation from 50 different angles, right? From any angle that you take the picture, there are so many components of, inequity. So first of all, there's history, right? The numbers, right? The numbers are staggering, right? When you see who put the deaths, right? Who put the people really? Who? The minorities, right? Minorities. For a number of reasons. I mean, like so many conditions, right? Let's start for the jobs that we have, for the living conditions, for overcrowded living conditions, from the type of jobs that is almost impossible for people to get, a social distance, and continue, and it goes and goes and goes, right? It's when you say impact, and let me tell you, in our organization, we have a series of metrics, and we have been monitoring the pandemic since the beginning, right? So every week we gather all the information, we make a plan how to handle the response to the pandemic. And one of the things that are for me really sad is, when you see the positivity rates, the death rate, you have the data from Chicago, and you have the data from our organization. It's completely different. Like, for example, last couple of weeks, when Chicago went to 17% positivity, we were in 24.
Wow.
Exactly. Let's talk about vaccines, vaccination, access to vaccines, especially when supplies were scanty, right? So the inequity was there, right? And the target for the education and the, people being able to see a provider or get access to care, was limited, So this really unveiled, a really, really bad situation. And it continues to do every day. The social determinants of health, transportation, right? Is, most of our people really, when I talk about minorities, I mean, the percentage of people with education, like can work, from home is small, right? If you are working in a restaurant, if you're working in services of any kind, you can isolate. It's so difficult to isolate, right? Do you have the resources to buy a good mask? So you see people using bandanas that are useless, right? Or using masks made out of clothes that the CDC say they don't work really. But can people really buy N95s, right? Now it's coming, but it's been 2 years later, right?
Exactly.
Our people don't have access to those things. So again, that's why I said the pandemic was really, showed the reality that we live, that the realities and the inequities, unfortunately.
Just hearing that 24%, and that is really shocking. I'm surprised, but not surprised.
Yeah.
But that is drastically different.
Absolutely. And the vaccine hesitance, and again, there's a lot of history here, right? When in the past, decades ago, minorities were affected by misuse of vaccines or inappropriate selection for many things, from studies, from all kinds of things, right? So there's this history component, there's the education component, there's the language barrier, right? Are we getting the message to the people about the vaccines, right? Why are we getting the battle against, fake news and Facebook and, all these things that are happening? I can tell you, you can be amazed of the things that circulate in media. This is what our communities are getting first, right?
Yeah.
Are getting first. In other countries, there is a platform that is very popular. It's not here, but it's the one that everybody uses in other continents. It's called WhatsApp or something. I mean, I can't tell you the things that you can see over there, and they are in their languages. So people just receive this and take it, right? Take it. We failed to communicate adequately to our population. We failed.
You bring up such a good point about platforms, like, especially I think in the Latino community, because my mom over the last few years has gotten into like the social media realm, and she's older, and I'm like, and she's sometimes she'll like share things with me on that she saw on Facebook, or they have WhatsApp as well, because that's how she communicates with family in
Right.
Mexico, and stuff. And she's like, oh, this came through, and and I hear people like sharing things, and I'm like, that's not true though. Like that's not real. Like that's and there's this sharing of information as that is like, oh no, these are the facts, this is the truth. And when you say like, we have failed to kind of earn the trust, like, the United States government has failed its people because of, the things that they've done in the past, and not reconciling that, and taking ownership of what was done to people in the name of health and healthcare, and in doing so. And I think that's such an important thing to bring up, and to really say, like, there is this mistrust. And a lot of times I hear people in sort of the professional circles that we're in say, like, people just need to like get over it, or need to just move forward with it, and like, yeah, that's just in the past. And I was like, it's in the past for who? Like,
Yeah.
because for some of us, we're still living it or still being impacted, because it doesn't matter how far in society maybe the three of us get to, the way that we look, the way that we talk, our names will always put us into a bucket, into a box, and we can't outrun that. Like, we can't outrun it. And I think a lot of there wasn't that acknowledged, especially early on with the vaccines. People are like, oh, why aren't our Black communities getting the vaccine? And people are like, this is why. And the mainstream media was like, well, that can't be it, like that happened years ago, like that's not even relevant. And it's like, have you seen what's happened in the Black community just within the last 2-3 years? Like, it's still happening.
Still happening. Exactly.
And it's unfortunate that even when you think about the Latino community, and sort of the mistrust that the last administration has done, and the hurt that was done, and just the way that the Latino community has been sort of just bombarded into this whole monolith of things, and sort of having that and trying to rectify it during a pandemic, and trying to like, why aren't these Black and brown communities doing what they're supposed to do? Is like, we can't. Like, you touched on the work that a lot of our friends and families do, that doesn't afford them the possibility to work from home. A lot of people had to work through the worst of the pandemic, and being exposed to it, and bringing it into your multi-generational homes. Like, that to me was just, to not have a government that cared about people's health, to say, hey, we're going to take care of our people for like a year or 6 months, to say, let's get this under control. Like, that to me was like, just, it was maddening. Like, I know Martina and I talked about it early in the beginning of the pandemic, like how upsetting it was that the government couldn't take care of us. Like, they just showed complete disregard and care about our healthcare systems, and just like a safety net that was supposed to be there, that wasn't.
And as we've said, like, this is supposed to be, people think this is probably the most advanced country in the world. I don't think I'm of that belief, but this country is supposed to be one of the most advanced countries. And this is where we are, where everyone can't even get healthcare. And if they can't get healthcare, it's not equitable. And we have people who are just trying to like wrap their head around, why is it so difficult? Like, why don't they want to do this, that, and another? And if people say, oh, well, this happened so long ago. No, this is happening right now. It's
Right.
happening in the communities. You may not see this in your community, but there are people living this life every day. And sometimes those people really don't see a way out. And I think more of this has come to light since 2020, because 2020 was just an explosive year. Just a lot happened. But as we all are collectively saying, there's still so much work to be done. And I think that's what a lot of like politicians, and as you mentioned, Dr. Mejia, activists and different individuals, either they are just choosing to outright ignoring the issue because of capitalism and money, or it's, what is it, in this country? And it's just, It really is, and it's sad. You know, this is a country that I was born and raised in. I was born in the South. I was born and raised in Mississippi, and so having moved from Mississippi to Chicago was a complete experience for me in itself. But when I moved here, I did have these notions in my head that Chicago, in many ways, was going to be different than what I saw in the South, and in many ways, it's not. It's a lot of similarities between the South and even just Northern in terms of many things. But it's just like I just had to touch on that because it's just really just listening to what we're talking about. And it's just, you know, how are we going to get out of this? You know, what's the way out? I don't know. And like we said, we can talk about COVID.
Yeah.
we have talked about COVID in and out and roundabout. And it's just, I don't know. And it's just, we're going into our third year with this, right? With COVID, this kicked off in 2020 and we're now in 2022. And
March 18, I think it was in 2020. But you know what, Martina, now that you mentioned this, you know, when I think about inequities in health and, you know, racism, it's not about just having an insurance card. It's not enough. And, you know, even if you have Medicaid or good HMO or PPO, it's not enough. What about, you know, how about the social determinants of health, right? That's another huge hot potato, right?
Yeah.
Is where you live will determine your health, right?
Yeah.
That's the plain reality, right? From air quality, water quality, right? From available of fresh food, right? So there are things that I always mention, and in every scenario that I have always mentioned two things, you know. One is that for many areas of Chicago, if you want to buy fresh food, and you don't have a car, you will need to take two buses
at least
to go to a fresh market. For me, that's absolutely unacceptable. That the second one, and this is an anecdote that happened to me. So I was doing in my job, I do rounds and visit different areas of the city and health centers. And I remember years ago, I was driving to a very, very, you know, let's say, area with a lot of challenges in the extreme south, close to Indiana. And I remember, you know, you're in the neighborhood, and suddenly I was driving when I saw a beautiful building, right? And I remember saying, this is so beautiful for this community, right? This is, I mean, what is this? It's a health center, a community health center, a community center, it's a school, it's a senior services center. It was a dialysis center. A dialysis center. So it's not only, we don't care about your kidneys, you know, but we care about when you get on dialysis, we want to be with you over there and make sure you have your dialysis available. Tell me if that is not absolutely horrible, right? So there is no really private investment in improving the living conditions. It's about, you know, a patient with Medicare will pay for dialysis regardless where you are, right? So let's put dialysis units. And that's just one example of the social investment. Why this, in my opinion, social contract is failing to the people, right? Because you don't have transportation, you don't have fresh food. You don't. How many drugstores have been closed in the city of Chicago? Closed. And the big chains is, I mean, really is business, right? It's business. How many hospitals in Chicago have closed, right? At least 2 big hospitals closed in the last 2 years. And those are not exactly located in downtown. They're located where, you know, the communities need them the most. Yeah. So again, is that concept of, you know, everything is related to, you know, revenue, and that's really sad because people are paying, you know, with suffering and shorter lives, and, you know, life expectancy is lower. You know, the death gap in Chicago, you know, well, you know, and for people who will listen this in the future, you know, the death gap in Chicago is, if you live in the front of the lake, right, you will have 30 years longer life expectancy than if you live in the west of Chicago, just 15 minutes drive. Take a 50 minutes drive, west or south, and your life expectancy decreases 30 years.
So if you're 80, you're only expected to live until you're 50 in some of these communities.
Exactly.
Maybe.
And it's not only about chronic conditions, diabetes, hypertension. It's about violence too.
Yes.
Violence. So another critical point: social conditions, social determinants of health, and that's the reality.
You brought up a point that reminded me of when we ended up having to take my dad to the ER, back in December. And I won't say the hospital we were in, it's the one that's closest to us, but I remember going in and sitting down there and realizing that this place felt like people were coming to die. Like this hospital, I was like, it hasn't been invested in. It doesn't feel like a place where you're going to get healed or like it just, even walking in, just everything about it. And I remember I talked to Martina and I was like, this is terrible. The fact that in the community I live, the closest hospital to me feels like a place to go to die versus a place where I'm going to get care and just because of how it looks and it was one of those things where I hadn't been there in years because of the reputation it has and just as a community resident knowing that. But I'm like, no, this is terrible that we can invest in our communities where it's needed, that the investments aren't there. And it made me look at my community differently. Like now when I drive around or I'm walking around, I no longer see the nice things, because I used to just see like how beautiful, like I was like, I live by a park, and now I see everything that hasn't been invested in, that has looked the same for I mean, I've been living here since I was 5 years old, so like 30 years. And I'm like, and a lot of the things look the same that they did 10, 20 years ago because nobody has invested in it. Things have closed down, and it's like, I no longer see like what I thought was like beautiful. Now I'm like, and then I'm like, but where do you even start? Like, how do you even tackle something that is so big and needs more than just a band-aid, but needs like actual, systems and policy changes to make that happen? Is just, it's just incredibly like mind-boggling, overwhelming. But you made me think about like, there isn't the investment that's needed, whether it's from our government, private sectors. And even when private sectors come in and invest, there's always some sort of other thing that has to happen, or there's like a plan in place that doesn't really take the community, into account sometimes. And maybe they'll say like, yeah, we had community, workshops or hearing town halls and stuff like that. But it's never really at the benefit of the community. It's always more at the benefit of whatever institution is coming in. And it's sad. Like, it's sad. And I remember telling Martina about the whole hospital thing. And I was like, I don't know what I can do. Like, I don't know what place I can do to like figure out like how to make just, even if you just put new paint and some new seating chairs or something for people to feel like they're there and waiting for a family member not to like come out like that. It was a terrible experience to me. We ended up having to transfer my dad out of there because we knew he wasn't going to get the care that he needed. And that's unfortunate. Like, I shouldn't have to have taken my dad out of there for him to get the care that he needed. But I was like, it was just, to me, to this day, I just can't believe to have gone through that.
You touch a good point, Liz. People have the right not only to have health care, but really healthcare in the place where they live,
Mm-hmm.
And let me tell you, so we have some health centers in the west, far west of the city, and in the north side, for many times for services as basic as a mammogram, or to see a diabetes doctor, endocrinologist. They have to drive 25, 30 miles to get the care. That's not, I mean, like today, this morning, I saw one patient who, was working cleaning snow. So he, slipped in the ice, fell down and broke his hand, right? So I saw him this morning and he said, I need to see an orthopedic doctor. I said, well, who, and he had a cast already. So who did the cast for you? He said, well, in the emergency, they did the cast for me, but they say that I need a follow-up. And the problem is I don't have any insurance. And they told me upfront, the follow-up is gonna cost you $500. So here is this person, right? Who many times those people don't even feel comfortable going to the city, going to downtown is intimidating for them, right? Looking for a safety net hospital can take them, right? And see him. Because he doesn't have $500 for just a follow-up. It's just a follow-up, just taking a look, see how is he doing, and maybe on a plain x-rays. But if you don't have insurance, that's the reality. And you need to pay upfront. So it's systematic, it's embraced, it's systematic, unfortunately.
It's intentional. This is the way that, it's intentional.
That's really sad. And I have to be frank. I mean, there are many organizations working on that. There are many people that really are trying to make the difference and causing some impact. But almost all those initiatives came from the private sector, right? I think it has to be a more decisive, investment in these conditions of healthcare from the government, which is finally the ultimate, owner of this is the government, right? So I think good initiatives are happening, but the impact is not even close to what is needed. It's really a small impact, right? Compared with the huge amount of needs. Yeah.
Well, I think on that note, I think that's a good point to wrap up on. It's not a good point, but we could keep talking, but I know we are probably at an hour at this point. And so, Dr. Mejia, thank you. This is a great conversation. We would love to continue. We do have some time set up with you to continue this conversation. So this is part one of this. And there's much more that we still need to talk about. Like, again, we could keep talking, but thank you again for volunteering your time. And it has really been enriching for me to just hear you speak so plainly about the situations that are happening just here in Chicago and just happening across the world, because I think oftentimes people want to have the rose-colored glasses on, and it's not like that. And so, with that, Lisette, I'll let you kind of take us on home and wrap us up.
I'm gonna see Dr. Mejia. I don't know if you have any final words on just what we talked about and and then I'll kind of wrap us up. But just want to give you a final chance to kind of summarize anything.
Thank you for giving me a voice, right? For your good questions, for the time to talk these things slowly, right? I really appreciate that. I don't feel myself, I wouldn't be transparent with my professional standards, right? If I don't say the things that I feel and see every day, because they are there. I mean, the evidence is there, is the reality. So for me, it has been a good conversation, and I thank you for creating this scenario. And I know you are doing this with other, actors and people who are embedded in the communities. I think that's commendable, and I would really, really appreciate the effort, really. Thank you so much. Looking forward for another conversation. Absolutely.
Yeah, well, with that said, thank you again, Dr. Mejia. Thank you to those that have listened and tuned in and or watched, because we do know this is both a podcast and a video as well. As we have mentioned, we're going to come back with Dr. Mejia for a part 2 to kind of continue and also finalize some of this conversation. I think we'll kind of continue digging into COVID. We know that's still prevalent and things, but I think that there's other things we can talk about, particularly with the immigrant and healthcare. I think is another one that we'll kind of try to dig in at the next episode with Dr. Mejia. So stay tuned. Thank you for tuning in, and keep an eye out. If you have any questions, make sure you kind of DM us or put it in the comments below. And we'll kind of, if you want to communicate, we'll put all of our social media links as well in the description box. So feel free to reach out to us with any questions as well. So thank you all, and we will talk to you all soon and see you soon.
Thank you so much. Bye-bye.
Bye.